How many people in this room actually take care of patients? How many of you seen a patient have seen a patient get care they don't need? How many of you have seen a patient be harmed by it? So the percentage of people who have seen harm is pretty high. About a third, and it happens every day. About a third of CT scans are unnecessary, and those unneeded scans are causing cancer. A 2009 study from the National Institutes of Health estimated that CT scans done in 2007 will cause a projected 29,000 excess cancer cases and 14,000 excess deaths over the lifetime of the people scanned that year. There's harm from unnecessary stenting. We do 500,000 elective cardiac procedures each year, and if only 10% of those are clearly unnecessary, and we know the number is higher, that means 50,000 unnecessary stents a year. That's at least $1 billion of unnecessary care. But overtreatment is not just about the Benjamins. 50,000 unnecessary stents translates into more than 500 people who are serious hurt and maybe even killed from getting a stent they didn't need. I could tell you stories about patients, about the woman who got an unnecessary cath, whose aorta was perforated, who ended up having to have bypass surgery. The bypass failed. She had to have a stent. The stent failed. She had to have a heart transplant. I could tell you the story about the elderly man who survived Normandy, lived to 88, and then had an unnecessary surgery for colon cancer that led to a terrible infection with C. diff. He died after suffering from 6 months of unrelenting diarrhea. I could tell you about my friend Helen Haskell's 15-year-old son, a funny, athletic kid, a star student. He had a mild cosmetic condition called pectus excavatum. You guys say it. His parents had no idea the surgery posed any risks. Their son died in terrible pain from a drug that was misused and led to a massive infection. Then there's Patty Skolnick's son, who died after unnecessary brain surgery. And I could tell you about the elderly man who was hospitalized for 10 days last Thanksgiving, when what he really wanted to do was go home and die. And that story is about my father. This is the price we pay for overuse. It's not the money that matters, it's the wasted lives. Now, I know these stories are hard to imagine if you're a patient, but let me tell you, they're also hard for doctors and nurses to hear. Now, some of them don't want to hear it because it interferes with their ability to make a living. But the vast majority have a hard time hearing it because they're doing their best to do what's right for patients within a broken system. They are cogs in a gigantic industry. So think for a moment about the sheer size of our healthcare industrial complex, and we should make no mistake, it is an industry. Just as surely as there is a military industrial complex, we have a medical industrial complex. And for all those good and caring people in white coats, this is an industry that is so hugely profitable, it is almost impossible to avoid doing the wrong thing if it makes money.